Dementia is not a single disease, but rather a broad term used to describe a group of symptoms affecting memory, thinking, and social abilities, severely enough to interfere with daily life. It's a progressive condition, which means it typically worsens over time. While dementia is more common among older adults, it is not a normal part of aging. People with dementia may have difficulty remembering names, dates, or recent conversations, but they also struggle with reasoning, problem-solving, communication, and even behavior. Dementia can affect mood and personality and can significantly impact relationships and the ability to live independently. One of the most important distinctions to make is between dementia and the normal aging process. As people grow older, it's common to forget a name momentarily or misplace things now and then. These occasional lapses in memory are typically not cause for concern. In contrast, dementia involves more persistent and noticeable cognitive changes. For example, someone with dementia might get lost in familiar places, struggle to carry on a conversation, or forget the purpose of common objects. These are not just memory issues. They reflect changes in the brain that interfere with daily functioning and quality of life. Alzheimer's disease is the most common type of dementia, accounting for roughly 60 to 80% of all cases. It is caused by abnormal buildups of proteins in the brain, namely plaques and tangles, which lead to the death of brain cells. Alzheimer's typically begins with subtle memory loss, such as forgetting recent events or conversations, and gradually progresses to more severe confusion, disorientation, language difficulties, and changes in personality. As it advances, individuals may lose the ability to perform everyday tasks and require increasing levels of support. Vascular dementia is the second most common form and results from problems with blood flow to the brain. It often follows a stroke or series of small strokes that damage brain tissue. Symptoms can vary depending on the location and extent of the brain damage, but often include difficulties with problem solving, slowed thinking, and challenges with concentration and organization. Unlike Alzheimer's, memory loss may not be the first symptom. Vascular dementia can sometimes appear suddenly and may progress in a stepwise fashion, worsening after each stroke or vascular event. Lewy body dementia is another type of progressive dementia caused by abnormal protein deposits known as Lewy bodies in the brain. These deposits disrupt normal brain function, particularly affecting areas involved in thinking, movement, and behavior. People with Lewy body dementia may experience visual hallucinations, movement problems similar to Parkinson's disease, like stiffness and tremors, sleep disturbances, and fluctuations in attention and alertness. These shifts in cognitive state can be rapid and dramatic, which often makes the condition particularly confusing for caregivers and staff. Frontotemporal dementia, or FTD, is less common, but is the leading cause of dementia in people under age 60. It affects the frontal and temporal lobes of the brain, which are responsible for personality, behavior, and language. As a result, individuals with FTD may show marked changes in social behavior, emotional responses, and communication. They may become inappropriate, apathetic, or withdrawn. In some cases, language problems dominate, leading to difficulty speaking, understanding, reading, or writing. FTD tends to progress more rapidly than Alzheimer's and often lacks the significant memory loss seen in early Alzheimer's cases. Mixed dementia occurs when someone shows evidence of more than one type of dementia. Most commonly, Alzheimer's disease combined with vascular dementia or Lewy body dementia. This condition is more common than previously thought, especially in older adults. Because symptoms can overlap, it may be difficult to diagnose mixed dementia definitively without a brain autopsy. However, signs often include a blend of memory loss, confusion, movement problems, and changes in thinking speed or behavior. Understanding that multiple causes may be at play is important for tailoring care appropriately. Another less common but still relevant form is Parkinson's disease dementia, which occurs in people with Parkinson's disease. While Parkinson's primarily affects movement, In later stages, many people also develop dementia symptoms, such as slowed thinking, difficulty with concentration, memory loss, and hallucinations. It shares many features with Lewy body dementia, because both involve Lewy body protein deposits. However, if cognitive symptoms appear more than a year after movement symptoms begin, the diagnosis is typically Parkinson's disease dementia. Huntington's disease is a genetic condition that causes the progressive breakdown of nerve cells in the brain. While it's often known for its motor symptoms, such as uncontrolled movements, it also leads to cognitive decline and behavioral disturbances. Symptoms usually appear between the ages of 30 and 50 and worsen over time, with dementia being part of the later stages. Since Huntington's is inherited, it has unique emotional and ethical challenges for individuals and families. Creutzfeldt-Jakob disease is a rare and rapidly progressive form of dementia caused by misfolded proteins, called prions. It usually leads to death within a year of diagnosis. Symptoms include rapid mental deterioration, mood changes, coordination problems, and involuntary movements. Though it's extremely rare, it is important to be aware of because of its speed and severity, which make it distinct from other types of dementia. Wernicke-Korsakoff syndrome is a brain disorder often associated with chronic alcohol misuse and a severe deficiency of thiamine, vitamin B1. It's technically not always classified as dementia, but it can cause profound memory problems and cognitive impairment. People with this syndrome may fabricate stories to fill in memory gaps, a phenomenon called confabulation, and have trouble learning new information. If caught early, some symptoms can be partially reversed with proper treatment, including nutritional support. Understanding the different types of dementia helps caregivers and support staff respond more effectively to the unique needs of each individual. While many symptoms overlap, the progression and primary challenges can differ significantly. By being able to recognize the signs and understand the nature of each form, care providers can offer better support, communicate more clearly, and create environments that promote safety, comfort, and dignity. Although the progression of dementia varies from person to person, it typically follows a general pattern. In the early stage, the first signs often include minor memory lapses and subtle changes in behavior or thinking that may be easy to overlook. As the condition moves into the middle stage, these symptoms become more noticeable, with increasing confusion, greater memory loss, and behavioral changes that begin to interfere with daily life and personal relationships. In the advanced stage, the level of impairment becomes severe, and the individual usually requires full-time care and support to carry out basic activities and maintain their safety and well-being. Dementia is challenging for everyone involved, the person experiencing it, their families, and their care teams. But with knowledge, patience, and compassion, staff can make a profound difference in the daily lives of those affected. Recognizing dementia as more than just memory loss and understanding its many forms creates the foundation for respectful, person-centered care that honors the humanity and individuality of each person, even in the face of a difficult diagnosis.